with the characteristic deformities in the feet. But my observation and our colleagues' observation in Pakistan, we do not see so much foot deformities as we see in the UK, or as we saw in the UK. And one of the proposal was that it is because of the footwear that we tend to wear open shoes much more frequently. Yes, that's true. Now this is not a patient, not the same patient.
More crowded toes. You actually doing a bit of this. How was the person who was the sort of orthopedic surgeon with liver working?
Yes.
And every week, Professor Khan was a consultant, and you would have a sort of combined orthopedic meeting with them.
That's right.
When I first went there, I didn't know that it was he who had done the first operation. It's named after him.
Yes, yes. Just excise the. That's true. Yeah, yeah. Now the more popular surgery in the toes has now become fusion. Okay. Now what do you see here? There is almost no distinction between the carpal bones. This is a highly destructive disease, and you see this deformity. And if I can use some imagination, this is a cup and this is a pencil and a cup deformity. So it is a very destructive arthritis. It is referred to as arthritis mutilans, and the condition was psoriatic arthritis. Okay, for trainees, anyone? What do you see here? What is the image shown? Yes, but they have to tell us what this. Yeah, this is the lateral view of the spine, right? Cervical spine. Yes, this is a lateral view of the cervical spine, but there are two views given for the same patient. That means you want to look for something that changes with movement of the spine. Do you understand? Now, if this was the patient who had psoriatic arthritis and you send this patient for surgical fusion of the toes and you later heard that the patient died on the table, what is the problem? Very good. So you see, this is the arch of the atlas. This is the dens or the odontoid process, and the arch of the atlas and the dens is closely applied to each other. Now this is normal anatomical position, and even in movement the annular ligament holds them together. But this is one area of the spine that can be affected in chronic rheumatoid arthritis. And when you ask the patient to flex, the head pulls the atlas or the arch of the atlas forward, and the dens remains behind because of the spine. So they are not functioning as a single unit, and there is separation of more than 4 millimeters between the posterior surface of the arch of the atlas and the anterior surface of the dens of the second vertebra. And if you see that, this is a very critical patient, and you should never subject this patient to endotracheal intubation. If they require anesthesia, it will be done after a collar through a nasotracheal intubation rather than an endotracheal. Do you understand that? Yes, yes.
Just to remind me, because it's very simple. It's a transverse ligament. When you inadvertently put pressure on the cord, if he's dead, he will be caught.
It will go and press directly into the medulla oblongata. There is quadriplegia,